said, we are pregnant. He took ownership of the pregnancy. But 99.9% of the men in this country run away from responsibility and leave the girl child on her own. But the saddest part is we're not just talking about the fact that she will miss school. She's not ready. She's a child. She's not ready to be a mother. She's not fully developed bone structure. She will suffer from anemia. She will not be able to give the child the best because one, she's probably coming from a poor family. You know, I always say that the rich can take care of their pregnancies without even government knowing, all right? They can take their children to good hospitals and take care of it. But the very, very marginalized, the very, very poor. And if we want to kick out poverty as a country, we have to get contraceptives to the children if they're having sex, all right? So in Europe, for instance, they're lowering the age of consent in terms of contraceptives because they've realized that children, even at the age of 14, are having consensual sex, all right? Now, here in Kenya, we say it's against the law, it's a criminal offense. But when the judges have been challenged when you have a 14-year-old who is actually impregnating a 14-year-old, how do you send that 14-year-old to jail? Because this is consensual, it was not rape or abuse. Now, if you're an adult and you're having sex with a minor, that's defilement, that's rape, that's a criminal offense. So I feel that the church and the religious sector have to really come out strongly and allow for comprehensive sexual education. Now, what they say is that the reason why they do not allow it is because when you teach sexuality in schools, you will have to teach about all gender identities, all right? And unfortunately, the church looks at that as a way to promote homosexuality, lesbianism, but then we have transsexuals, then we have intersex. These are people that are within our community. And I mean, even the Pope has come out and says, we cannot judge, only God can judge. So I feel men should start guiding us without judging us, because it's not their position to judge us. But Jamila, one of the things that I'd really like us to talk about, do we have, because the Muslim community is very protective over its data, and I know you marry the girls at a very young age and you protect the girls, but now in urbanization, you know, it would be really nice to look at what is happening also in that community, because I know that there's been a lot of hue and cry about rape in the community, and then you have the masla, you have the settlement. So if you have that, you probably also have teenage pregnancies. How do you deal with it? You get the girl to marry the boy, and then you forget about it. So we are giving a misconception that this is a morality issue. It's not a morality issue. Children will have sex. I mean, when I had sex the first time, my parents didn't know, all right? But I was protected, and our society was different then. Today, our girls are not protected. They're out, they're walking on the streets. There's border, transporting girl child, giving her a sweet, taking her to the bush before he drops her home. So if the parents do not talk to the children and make the children feel safe coming to talk to the parents, then we have a problem. There is, what age should we start talking to our children about sex? Do you know? 7 years old. Good touch, bad touch. How to wash your private. Why is it private? How do babies come? I mean, my mother told me I came through a balloon dropped by some bird. I grew up hoping that I was born in the neighbor's compound where there was a swimming pool, not where we were born. So we have to talk honestly, and we have to call it by its name, not these names that we come up with, doo-doo or nunu, or, you know. So I think we have to fight as women, all right, for comprehensive sex education in our schools. But it also starts from the house. We can't leave it to the teachers. We also, as parents, should go and buy sanitary towels, whether you're man or female, for your daughters. You should talk to them, because at the end of the day, they say the girls will marry somebody that looks like their father. So he should be honest with her. Parents should be honest, because once a child understands that my parents are not honest, then they also will have secrets from the parents. So I feel it's a crisis. You know, the 100,000 students that haven't reported to school, maybe it's a shame thing. They haven't reported because majority of them are girls who are pregnant and they can't report, or the parents have defiled and abused their children and they don't want the children to go back to school. So we need to really be open and talk about it openly, because it is a crisis. No young girl should be pregnant. Her life is destroyed by the pregnancy. And for the ones whose lives were not this, you know, they might not, they've stepped up these are two, Shiru and Rashid. There are very few who will step up. Majority of them, they have scars for life. They end up being single mothers. The next children that they give, they end up being single mothers. So it is a crisis. It is bad, and I'm glad we're having this conversation, and I'm so grateful to Amref for putting it together, and the journalists coming forward, because you really are the ones who can actually educate people.
Thank you, Honorable Pasaris. You brought up a lot of issues and took me back to when I was younger, and whether these issues used to come up at all. I only remember us being told that you needed to be a virgin when you get married, otherwise it will be a huge thing of shame to your family, to your mother, to your parents. And that's the one thing I think that kept us so on our toes, because we didn't want to bring that shame to the family. But we don't talk about it with our children. I have teenagers and young adults, and when the time came to have those talks, it was really, really difficult. That I was asking help from an older sister or my brother, talk to the boys, because I don't know, for some reason you're unable to sit with your child and talk to them about what they call the birds and the bees, but they need to know. They need to know. And I think I'd like Mageda Esolio to come in here and talk about the accessibility, about gender and reproductive health rights, and whether information on contraceptives is available. I know, as religious as we are and as cultural as we are, talking about contraceptive also is a big no-no. You cannot allow your child, a 10-year-old, 11, 12, 13, 14, start being sexually active and giving them access to contraceptives. Mm-hmm. But I think where we are right now, those are conversations that need to be had. The numbers you're talking about, 150,000, is huge. And I remember watching one of the features we did of young mothers going back to school after giving birth, and how they'd go home during lunchtime to breastfeed their children, or those who live near the school would have their mothers or some of the caregivers bring the children to school for them to breastfeed. And they do it under a tree in the compound, and other students can see them doing it. What does that do to them? Yeah, what does that do to them in their minds, and as they try to give themselves and their children a better life? So Mageda, come in and talk about issues on contraceptives, and whether information on this is available, and whether young people know about the availability of this contraceptive. Mageda? Can't seem to. Mageda, can you hear us? You can, please.
Hi, so sorry. Yes, I'm here. Sorry, I didn't get you, and my internet just dropped when I was about to start speaking. Sorry about that.
No worries. Just talk to us about the accessibility of the gender equality and reproductive health rights to the teenagers and young adults, and whether information on contraceptives is readily available for them, and are really health facilities willing to dispense this to the teenagers?
Great. Thank you so much for that question, and so happy to be here with you today and the rest of the team. First of all, I would just like to piggyback on most of the speakers and what they've said. In Kenya, access to information, particularly sexual and reproductive health and rights information, is not readily available to teenagers and young adults. And we know that we have signed treaties in terms of access to information, and that rights and access to information is actually a fundamental human right. So just to start with, there's no accessibility to this information, and there's no accessibility to contraceptives, because I think with definitely the team and our panelists, they spoke on the fact that when they were going through the crisis of accessing information when they became pregnant, when they went to the facility, the first questions they got were very saddening questions, to say, just to speak on actually bringing bias against young people getting pregnant. Example, being asked on how are you pregnant? What is your age? And so definitely, first of all, even the spaces whereby young people, teenagers, young adults would access this information, those spaces are highly stigmatizing and are highly stigmatized. And you'd find that young people would not want to access these spaces, would not want to access the health facilities. Also, just to add that most of the health facilities that have been available or have been created in our various counties are usually very far away. When you go down to counties such as Kilifi and looking at the spaces, such as in Bungoma, looking at how far one person would have to go to access reproductive health services, let alone an adolescent, you'd find that they're very far and not easily accessible to the young people. that's just making it more difficult for them to access these services. So other than, first of all, taboo around the conversation, the stigma around young people also being sexual beings, our society has deemed it in such a way that adolescents between 10 to 19 are seen as people who are asexual. And so when a young person wants information, wants to access information or to have a conversation around their sexual reproductive rights and their sexual lives, it's something that they cannot have in any space. And also in spaces that it's safe, for example, in the school spaces, the information is very little. It's not enough for them to be able to really get enough information. So you find also at the home setup, it is not something that young people can access this information. And also when you talk about accessibility to contraceptives, contraceptives are not readily available. Even when we go past the age of 10 to 19, they're always there. Contraceptive stockouts, but you'll also find that service providers have the need to talk about, as a young person, you can't use this contraceptive without looking at it objectively and seeing a patient coming into a facility and being able to give them access to contraceptives. So in terms of really having access to contraceptives, having access to information, the young people, particularly in Kenya, do not have access. It varies with various counties, but more on the side of access is really a big challenge. Are the facilities willing to dispense this to teenagers? No, facilities are not willing to dispense this services and information to teenagers. And it's sad because we see service providers also coming in with their bias. Instead of coming in as a trained health profession, coming to do their job. So really looking back at our policies and looking at what a service provider is supposed to do in terms of dispensing this information to teenagers, and are they willing to dispense the contraceptive to teenagers and the information? But to also say that most of our policies are a bit clashing because according to the Kenyan Constitution, you can't have sex under 18. So when a service provider starts giving you contraceptives, are they aiding and abetting someone who's going against the Constitution? What would happen to them? And you find that also in terms of even marking down teenage pregnancies, the ones that we have in the data as being presented and the ones that are there in the facility and people are okay with writing them down. But we also realize that very many service providers would be at these facilities and would be worried to actually take down the data because you do not want to be the one who's dealt with that person. And looking at our community and our society with a particular focus on sex and sexuality in our society, you'd find a health facility in your neighborhood. That health facility in your neighborhood was probably that person, you know them. How does that conversation go about? Are you comfortable going to that facility? And you find that young people saying that I'd have to go very far away from, my community to be able to access this information, even if I think about it. And it's a lot of trauma and a lot of really loopholes that they don't have to go through. So I would say that the information is not available. And also in our society, the information is people who have the right and the mandate to dispense this information are not willing to dispense the information.
Thank you, Mageda. Thank you so much. And when I look at our charts, I see a whole conversation about contraceptives and whether children should be given information about it. Some talking about abstinence. There's a whole push and pull here. Those saying the children should not be allowed to have contraceptives. Some saying that some of them know a lot more than we do in terms of what it is, what sex is, and they're engaging in it. And you ask ourselves, where do they get this information from? And we're going to have a question and answer session. Please, let's keep chatting about this issue. I can see people are getting very emotional about it, but it shows you how important it is that our children need to be protected. Faith, what is the role of the civil societies in CSE, looking at how now issues to do with abstinence, whether children know their rights, whether sex education is being taught? I'd like Faith to come and talk about the role of civil societies in the CSE. Faith?
Thank you, Jamila. I think I was just like you, I was going through the comments and seeing how emotions are erupting. One of the role of civil society, number one, civil societies have always partnered with government. And speaking of government, I would like to mention in a few how government is coming in here in the whole comprehensive sexuality education started happening in 2013 when governments in all the regions, the East Africa and Southern Africa region, met in South Africa and did a ministerial commitment on comprehensive sexuality education and adolescents accessing sexual reproductive health information. So in this commitment, which Kenya is one of the countries that participated in this commitment, it brought a lot of backlash also with religious leaders, with political leaders, and who are questioning why is it that adolescents are going to access this information? Why can't we regulate it? And as much as I feel that the government has the willing heart, but the body, which is the surrounding, is actually failing them. And it's because of communities not understanding all this. You look at the backlash that we've been having also with some of the political leaders. Why is it that political leaders do not want comprehensive sexuality education? Is it because they're going to lose their votes when they go to the community and they're seen as, pro-sexuality education, they're going to lose their votes? Why is it that religious leaders are also against comprehensive sexuality education? Is it that they're going to receive backlash from, what do we call them, the congregants? But then if this is the case, Jamila, a few days ago, a bishop also was in a kind of a situationship, and he impregnated another, what do we call them? These condos. But then young people were asking, if religious leaders are also in this situation, why is it that they're also standing against also some of the things that are affecting them? Yet they have also, quote unquote, fallen short of the glory, just like some of the young people also, quote unquote, fall short of the glory, which means that these conversations should start happening, and they should start happening at the community level. As much as we have likes like Shiko and Rashid being very strong and even taking up responsibility, we also have young people who are not as strong as carrying the pregnancy to term. So communities need to understand what are the data behind. How many lives do we lose when we have teen pregnancies who are seeking for abortion services and they are seeking for unsafe abortion? How many lives do we lose? How much does the government spend in terms of post-abortion care? Because that is also another conversation that we need to understand. And communities also need to understand this. I'm tempted to use the word bottom-up approach when I talk about community, as long as this is a very, it has taken another way. The bottom-up approach has taken another way. But in this scenario, it means community have to understand this data. I'm a political science student, and one of the political anarchists says that you can't have just leaders within just societies, which means that these leaders come from the societies, and society needs to understand this. Community needs to understand what is the importance of comprehensive sexuality education. Is it in the naming? Nowadays in Kenya, we've always had this debate that comprehensive sexuality, just like Mheshimiwa Parsaris said, it's promoting all these immoralities that are deemed immorality in the, in our societies. But then communities need to understand that we have female-headed households that are adolescent. So when you talk about even age-appropriate information, what is age-appropriate information? For a young person who is 15, 14 years old and is heading a household in Korogocho, in Mukuru, what is age-appropriate information for this young person who is already maybe a mother who is taking care of the siblings and who is already deemed as an adult? So what I'm saying, Jamila, is we need to start this conversation from community. The government already has made commitments, as much as the commitment is having a lot of backlash and bottlenecks, but then it's having these bottlenecks because communities don't understand. And this is where civil societies comes in. Civil society has a mandate of two. I feel they have two roles to play. Number one, co-creating this thing with the government in terms of financing. commitments without financing cannot go anywhere. We are having good programs that are based around sexuality education and comprehensive sexuality education, and it also needs financing. Government in itself might be a bit challenged in terms of financing, but when civil societies comes in and support and co-create this with the government, then we see a milestone. Number two, acting as a watchdog and also supporting communities to understand this thing broader, to understand this commitment broader. Government in 2020, government launched national campaign to end teenage pregnancies. And this one also was being done at the community level. It's the role also of civil society to ensure that some of them also work with community health workers that are also integral part in this process, to understand that these communities understand what do we mean by really sexuality education? What do you mean by comprehensive sexuality? So it's in terms of just unpacking this to community. And if communities own it, then the leaders get to own it, because some of the leaders are afraid of taking the steps because they're going to get backlash from the same communities who have put them into these leadership roles. But the communication needs to happen.
Thank you, Faith. You've mentioned the government quite a bit, and I saw Honorable Pasaris nodding and agreeing with what you're saying. Maybe I can let you come in here now, Honorable Pasaris, and then we can have Dr. Owen and then Helen also speak on the same.
Okay, so first of all, there was somebody who was asking about the Care and Protection Child Parent Bill on the chat. And that's a bill that is in the Senate. Senator Kaboka brought it in. It has yet to come to the National Assembly, right? So just to give them an answer. But, you know, she's absolutely right that we as a country are failing. We're failing our women, our young girls, because at the end of the day, you know, when we don't take the bull by the horn, then the girl child is basically exposed. All right, and I feel that we there seems to be some noise. Sorry, somebody's got their mic on.
Yes.
Yeah. Okay. So you know what? We're having this conversation right now. But how is this conversation that we're having right now going to help the girl in Kibra or the girl in some village? You know, in the olden days, you would think that the village, the urban centers is where we had a problem. The rural centers had no issues. But now urbanization is happening everywhere with devolution. So these young girls are exposed. And if we don't start talking to them, right, and if we feel that religion is condemning this conversation that we should have, then every parent should have this conversation. All right. And Jamila, you know that religion can also deter what is right. The Muslim girl child was circumcised. Female genital mutilation was happening to the Muslim girl child. And it took just recently for sheikhs to come up and say, hey, this is not in the Quran. But it's still happening. The president wants to end it by 2022, but the religious leaders were actually not silent on it, right? Now, when we look at the Catholic Church, which is the predominant Christian religion that we have in this country and the most adamant, right? Rome, for instance, has legalized abortion, all right? Italy has legalized abortion. Greeks who have the Greek Orthodox have legalized abortion. Why have they legalized abortion? Because they recognize that if you don't create a structure that gives safe abortions, then what will happen is you're going to end up with children or women who are pregnant or girls who are pregnant going to the back street, like what happened with JMM. A 14-year-old girl in Kisii, she was raped. She ended up going to a pharmacy, given some tablets. The fetus didn't come out fully. She then went back to the pharmacy. They put some wires in her vagina. She gets an infection. Kisii level 5 hospital sends her to Kenyatta. She gets into a taxi, gets to Kenyatta. By the time she comes here, all her kidneys, her organs are failing. She stays in a coma in ICU for over 4 years, dies at the age of 17. I mean, was this necessary? If you go to Kenyatta, the post-abortion care that we're providing, right? It's ridiculous. We're spending over 500 million on post-abortion care. Let's put out commodities. Let's put out good messages. Let's educate our children. Now, I want to say something. My daughter, for instance, when she was young, she watched a movie called Dirty Dancing. And in that movie of Dirty Dancing, there was a girl who got pregnant. And then she was struggling with where should she go to have an abortion. And then eventually she ended up, her father ended up finding out, so I'm just saying that she saved herself by actually not letting a friend of hers go and procure an abortion in a bad place. She went to talk to her father, and her father took charge. So all I want to say is that we have to protect the girl child. And another problem we have is NHIF. NHIF and Linda Mama, you can only get into that facility if you're an adult of 18. Now, imagine you're a 10-year-old girl defiled by your father. So you're not at home, you're in a home. The home cannot even, a safe house, the safe house cannot even get you an NHIF card. So now the safe house is left trying to figure out how they're going to pay for that child to be delivered. The child gets delivered. You end up having a delivery and you don't even have the pelvis to push this child. You end up having fistula all your life. I mean, it's one wrong after another wrong after another wrong. I'll tell you, the lesser wrong is to let that child, who is, first of all, a child, not economically, not socially, not emotionally ready to have a child, right? Because also she's been raped by her father or her uncle or her brother. We have to allow her to procure a safe abortion at 3 weeks. For me, life doesn't begin at conception. Life begins when the child is born. And when the child is born, we have to make sure that also that mother can support. These churches, I don't see them coming up with orphanages. I don't see them coming up and saying we're going to help. I went the other day to St. Mary's Hospital, which is run by the Catholic Church. And when I went to St. Mary's Hospital, I actually was trying to beg them to release a woman that they had detained because she gave birth and she could not pay. And yet you're telling that woman you should not have an abortion. And when she comes to your facility, you're detaining her because she could not pay. So let us try, look, Jesus had 12 disciples. Let us get this message out to our children. And let's, somebody talked about, what do you call it? The morning after pill. Our kids are getting the morning after pill. Why not just put them on contraceptives? Let me tell you, Europe is not more immoral than us because their kids are actually having contraceptives at 14. They are more moral than us because they're not allowing their children to get pregnant when they don't want to have children.
Thank you so much. You're speaking about a lot of issues, and I can see as you speak, you've sparked conversation on the chat. It's really emotional in terms of whether saying you should not allow children to have contraceptives at a young age. Don't even talk about abortion. And those who are saying this is the only way to stop this from happening. The children need to have access to CSCs. People need to be able to have contraceptives, and we should talk about abortion as an option for a child who ends up pregnant through incest or through rape. I don't know what your opinion is, Dr. Christine.
Well, when I listened to Honorable Esther and the way she has really brought it out strongly that we need to rethink our law, we need to rethink the way we do things, we need to rethink what we have allowed and what we've not allowed. We need to rethink even the religious aspects, what we say it is good and what is not good, and really think about how best can we go about this. And the people that are against sex education, probably it's because they really don't understand what comes in when we are talking about sex education. Because sex education may take place in schools, it may take place in the community setting, or even online. And what is in sex education? It's not just about how people do sex or how people can abort and so on and so forth. We are talking about human development. We want the students, the children, to know about their reproduction, their puberty, what kind of feelings they should be looking forward to, sexual orientation, and things to do with relationships, how to relate with families at certain age, when it comes to gender, how to relate with your father, how to relate with your mother if you're a boy, personal skills like communication, yeah? When do you say no and do you mean it is a no? How do you negotiate in case you are caught up in a situation that you cannot handle as a girl? How do you make decisions in your life? We are talking about sexual behavior. Yeah, things to do with abstinence, of course, and that is what we have highlighted more when it comes to what we allow to be taught in schools. Things to do with sexuality throughout life. Because a human being, the moment you are born, you become a sexual being from childhood. So we need to be vanded and really come out strong and address these issues, even through sex education, as we are saying. We are also talking about sexual health, yeah? Sexually transmitted diseases, the contraceptions that we are talking about, pregnancy, abortions, what is good for us? And also we are talking about society and culture. Yeah, in many cases, I've heard you talk about the Muslim community, In sex education, this is supposed to be brought out so that our students, our children get to know their gender roles, the diversity, what we have in different cultures, and how they can be assisted. And therefore, the concept of sustainability is really critical. We need to focus on how do we then talk about sustainability. We want to curb this. And even as we are talking right now, even if we say this is the solution today, already we have children who are pregnant. How are we going to help them overcome the challenge that they are having? Now, when we talk about sex education, so to say, and at first I highlighted that we have a policy on education for sustainable development, which is actually out to empower and equip the current generation as well as the future generation to meet their needs using a balanced and integrated approach so that they are able to take care of themselves now and even in the future. In this education, we talk about not just information. We talk about skills, we talk about values, we talk about attitudes that will enable our children manage whatever challenges they are having sustainably, and even those that are not yet there. How can they be able to overcome those challenges when they come to them? Because we are talking about the way the human body is made, yeah? At certain times, there are those sexual feelings. Why can't we just tell our children vividly that these are the things that you're going to get when you get to the age of 12? How do you go about these feelings? How do you suppress, if you have to suppress? Or what do you do about them? Yeah? Can you go out there and become active so that you don't have to have your mind thinking about the feelings that you are having, that you need to go out and get a boy or you need to go out and get a girl? We need to talk about this through the straight talks that we used to have, where we have people who are courageous to come out and call a spade, that this is your private part, and you shouldn't allow anybody to look at it. You shouldn't allow anybody to touch it. Yeah? Be able to provide correct and consistent information along that line. Be intentional, as I said, in communicating about sex and sexuality to our young people, not just from the age of, let's say, we should say from the age of 16 and above. No, even those small children. I have very small children in my house, and the things I see them watch, I'm like, if I'm not there with them throughout the day, who is going to control them from watching those things? And what these children do after that, after watching, they will want to practice. To them, it's like a game. And yes, when it is a time when they're at puberty stage, it is something that they are used to. It's like a game. Eventually, they become pregnant. And so from there, they don't know what to do. So we really need to think about how our children should be able to access reproductive health services and health education, no matter what. And that is why I also want to take it back to Honorable Basalis and maybe bring it out in Parliament, that we need to rethink the law. We need to rethink the law and really see what is working for our people in this country. We shouldn't just look at what other countries are doing and say, okay, let us also do it. We need to go deeper and do some research. What is acceptable? What needs to be done? How are we going to do it? And then we need to also allow our teens and youth to make informed decisions after giving them the right information, after helping them to really understand why they need to make certain decisions and how they need to make those decisions. In essence, what I'm saying, it's not just about talking. It's not about writing policies, coming up with great ideas in the country. on how we are going to curb this. We need to bring in the aspect of the heart. Yeah, as much as we are talking about these things, how does it relate with the heart? Have the youth themselves, can the youth themselves develop some passion of wanting to know and wanting to do what is right? And
Thank
at the
you.
same time, allow me
Yes,
to finish
Dr.
this because
Okay.
this is very important.
Okay.
Media, what do we highlight most? Most of the time we are highlighting the negatives, where we are failing, what we've done wrong. Is it possible for us now to come out and bring out highlights on role models? Youth, the people, the teens who've been able to overcome those challenges and how they overcame, and how, so that they can be role models to these young people we are talking about. Thank you very much. Thank you very much.
Thank you, Dr. Christine. I see how emotional you're getting about this, and I totally understand. Even in the chats, people are getting very emotional in the issues that I'm emotive, because it's the future of our children we're talking about here. And Madam Pasari spoke about, and you also mentioned about how we talk about these things at a high level, but they really get down to the ground. How do you get them to a point where now we can see whatever policies have been passed actually being felt? But I wanted to bring in again, if she's still here, Mary Wanjiku Mwangi, who was a teen parent. You talk about we should be focusing more on those teen parents who managed to sort of like have a normal life afterwards, who have worked hard, who have let what happened to them behind and continued their lives. Mary and a few of her friends are doing something to try and help young moms in Mukuru. And this is what I talk about when I say, how do we get whatever is being talked up here down to the ground so that we can help people? And I'd like Mary to talk a bit about what they're doing in Mukuru to try and help young moms. Mary?
Thank you, Jam Jam. So, as I said earlier, so we have been doing a lot, like having just that safe space, which is the basic one, trying to get them to vent, because as a young parent, you go through a lot. Getting 15 shillings a day for a diaper is an issue if you're not employed. So when you're living with your mom, she's frustrating you. I think we will want to feel them in a situation where you are not working, you're an underage, your baby daddy is not helping you, and then psychologically you're not stable financially. So I think it comes around in that situation. So we create a safe space where they come in and they vent. And also at some point we don't have referrals for maybe financially, but at least when we talk about issues, at least we get to help each other. And then we create, sometimes we get referrals where they can get empowered. There's a point where Hope Worldwide was coming in, DSW as an organization, and Japaigo were helping in through empowerment, and also getting them getting them to learn about life skills. And then an organization like Utena also was helping out, and also is helping out. But basically we have an issue because we don't have funding. And we have tried even to reach Honorable Pasari's office without any with failure, or we only get failures when we try to get to her because of, I think, communication basis and such, because we are a small CBO, so they tend to think we can do less. So I think we have an issue, but the facility in charge, the facility in Mukuru, Lunga facility has helped in information, and also linking the young mothers to being CHVs. So at least we can reach more of the young mothers. And through information and also some of the young girls going back to school. But that has been another issue, because most of the school around, they don't want the young mothers to go back to school, because they tend to say that they will, how will I say it, ni kama wataharibu wale watoto wengine, because now they're mothers. So we have had cases like that. We have had cases like when they go back to school, they're not, their parents, so they're not given even time to go and breastfeed their kids. So the kids wanawachisha kunyonya, and that's inaleta issue kwa the young child, because ukiachisha mtoto kunyonya at an early age without even proper meals and everything, So yeah, so we have had a challenge, Jamila, and also through YACT, that has Sauti Sasa and YACT, we have also educated the young girls on advocacy. So ilifika time at a point where we couldn't go for any contraceptive. You know, in Kenya, we call it family planning, and it doesn't resonate with us young people when you say family planning. So when you go to the facility and you're asked your age and you have one kid, you're not planning for your family, you're planning for your own future. So we don't get access to those services. So at least with advocacy, when now they know their rights, they know what they should get and what they shouldn't get. So it has been easier for us to access those services, but kwa kifua so we have had issues around it, and we hope with all these we might get something. And also now that the Honorable is here, we can talk more with her, and then maybe we can have something at least sustainable for us to help these young girls, because the number is rising.
Thank you, Shiko. Thank you so much. As the Honorable Pasaris is here, I'm sure we'll find a way of linking you to see how she can help. Before I go to Mageda, I wanted to bring in Rashid again, and also as a former teen parent and what he has experienced, he's also doing a few things in the community to try and help other teens. Rashid, I want you to come in here before I allow Mageda also talk a bit more about this raging issue you're having about contraceptive and access and all that. Rashid?
Yeah, thank you for that question. I think for me, it's really just to reiterate a couple of pointers. Number one is what Dr. Christine was talking about. At the end of the day, sorry, at the end of the day, we need to remember that comprehensive sexuality education is not just about sex. And what we try to do with my youth organization, Maisha Youth, is reframe it into comprehensive sexuality empowerment. And Dr. Christine really brought it out very well, is that at the end of the day, we are empowering young people with the information to be able to make informed choices. And those are the keywords we need to really take out of this conversation. It's not just we're giving them information on sex and sexuality, but we're empowering them enough to make informed decisions about their sexual health, their mental health, and their reproductive health. And also just to be able to ensure that they're living fulfilled lives at the end of the day. And so it's really just about that. It's the empowerment. And then secondly is I feel that at some point we were talking about just how at the end of the day, you look at a young person at the moment and the amount of information that they're exposed to is really a lot. It is, and it's in very different ways, teaching them different things. And so as a society, we need to ask ourselves a question, is how are we complementing the information that young people are getting from movies, from music, from even just having access to internet and their friends, the conversations that they're having. So as a society, where is it that we are coming in to complement that information? And with this, one of the things that we do when we're doing advocacy is recognize that everybody has a role to play at the end of the day when it comes to just, talking about this entire topic on CSC and ensuring young people are informed. Is number one, it's not easy for us to change, for instance, the stance that religious leaders have on sex education and young people. As you so rightly mentioned, even in the Muslim society, in the Christian society, sex is only for the married people. And so how are we coming in as a society and complementing that and ensuring that if it's the in this religious space, then we complement that abstinence sort of approach, because abstinence, again, is still one of the safest methods of preventing yourself from unplanned or unwanted pregnancies, and also from risk of infection for STIs, including HIV. So how are we coming in and also amplifying that message on abstinence? How are we now coming into parents and the teachers and that the PTA sort of space and saying, so in this space, we now need to bring in the whole aspect of the empowerment bit. How are we giving information? How are we ensuring that at the end of the day, as a young person, if I choose to abstain, I know I'm abstaining because of A, B, C, D. If I've been put in a space and place where I am engaging in sex, then I know about the consequences, and I also know about how best to protect myself, have safe sex and safe sexual practices, alternatives to sex. How are we bringing in healthcare providers and ensuring that if myself as a young person, I go to this to a health facility, then I'm getting what we term as youth-friendly services, that I can be able to walk in and see nurse X and nurse Y, and it won't be a matter of how old are you, why are you asking these questions, these are not things that we're providing to you. And even just exactly what Shiko said is, at the end of the day, for me as a young person, it really isn't about family planning. It's about contraceptives to understand how best I protect myself. So how are we also using this space that healthcare providers hold to ensure that we are providing comprehensive, affordable, and quality youth-friendly services for young people? And then now we come to, like our community leaders, our political leaders, that whole aspect of ensuring that, the laws and the policies that are in place protect both the young person who might want to get the information and the services, and also on the other end, protect the provider. And this was so rightly put, that the laws of Kenya do not recognize that a young person is having sex. And Faith really just broke down that whole concept, is that sex is for people over the age of 18. So if I go to a facility at 16, at 15, at 17, even at 17, and I'm saying, yo, I am having sex, I'd like to have a contraceptive method to be implanted, or to get access to a contraceptive method. As a provider, you're not really sure what is that sort of line you're walking. Are you walking the line between providing the services for somebody who requires them, or are you actually breaking the law? And so we also need to be able to ensure that community leaders and our political leaders, our policy makers, are really brought into the space to ensure that the laws and the policies that we have really allow for young people to access as much information and services required to ensure that we're securing our future generation. And then I also love just the whole aspect of media. Bringing in that complementary education. If in media is where we're seeing the movies and listening to the music that is promoting, quote unquote, don't like to use this word, but quote unquote, promiscuity, then what's the complementary education that media is also providing, or media influencers are also putting out there that young people are interacting with? And so it's really just seeing how the society and all this, the circle of influence around a young person is complementing the education and the information that young people are getting out there, to ensure that we're not just throwing them into the the sea to be eaten by sharks, but they actually know how to swim and wade through that entire sort of system.
Thank you, Rashid. You brought out so many issues that I want our panelists to respond to. So I wanted Mageda to speak, then Elsie, and then you can have Madam Pasaris, and we'll take a few of your questions as we start winding up. Mageda?
Yeah, so I think, on my question was on what are the direct benefits and indirect benefits of contraceptives. So I would just start by saying that when young people have access to contraceptives, first of all, we are actually having conversations on what contraceptives are there in the country. What do we have at health facilities? What are the long-term methods? What are the short-term methods? I know in the chat box, there was a conversation around using of P2. You find very many young people using P2 and adolescents using P2, but they haven't gotten this information through comprehensive sexuality education. How much better would it be if these young people could access information, get proper contraceptives, and not be able to not use an emergency contraceptive every other time something happens? When you have access to contraceptive, the direct benefit is that when these adolescents engage in sex, you know that they are actually making decisions whereby they know that at this point I'm having my period, I can't have sex, this is what's happening. So for example, in the case whereby she was talking about, I didn't know I was pregnant, such conversations would happen if they can access health facilities whereby they can have conversations about contraceptives. What methods are there? What can you take? And when it comes to talking about demystifying the misconceptions, people generalize what contraceptive does to different people. Or it makes you fat, it makes you thin, it does this to you. Whereas most of these people have not gone to the facility to actually even talk to the health service providers about the contraceptives. So the first thing is to ideally go to health facilities, provide a space whereby accurate information, correct information is given on, the IUD, which one can you use, what can you not use? And also if the health facilities are available for teenagers and for everyone to access, then if the contraceptive is not working for you, you can go back to this health facility and say, I put in a method for 3 months. I am feeling this way. Can I change it? What can I do next? Because we access health facilities in that way when it comes to healthcare comprehensively. Most times people want to go when there's a problem, but with your relationship with a health service provider is something that you need to follow up on, especially for young people throughout your reproductive health, age, health for women particularly. We need to be able to access this service. We need to be able to go and have this conversation. So most of the misconceptions are coming from the fact that we generalize this conversation. Sex and sexuality is a taboo conversation. So when we go at it in terms of talking about contraceptives, as earlier stated, we talk about family planning. And yet we have teenagers who are between 10 to 19 and they're not family planning, they are life planning. And they want to plan their life. They want to have wanted pregnancies. So another indirect benefit is that when someone gets pregnant at whatever stage and age, it's something that is planned, that it's a process, that they're ready for, that they're economically stable, that they're in a situation whereby I can go to a facility and say, I'm now pregnant. This is something I planned. I knew this was coming. And then they can continue the process. But as of now, we just continue flouting myths around, especially when it comes to contraceptives. And these myths turn into hearsay. Everyone talks about, oh, this makes you thin, this makes you fat. And it ends up to that position whereby we have unwanted pregnancies, which lead to an unsafe abortion. And truly that is a very big issue. So another indirect benefit people can access, we assume contraceptives do, that young people would be more comfortable accessing facilities. But just to understand that, to demystify this as well, facilities need to have a space whereby young people can have conversations about contraceptives openly, so that it's something that we know. There's a time we had condoms campaigns over and over and over in our TVs and everything. Why can we not have campaigns about contraceptives on TV, so that that information that is in mainstream media is something that young girls and young boys can access? How do young girls and young boys access information around P2? And no one tells them that the overfrequent use of P2 does something to your reproductive health system, right? So there needs to be that information whereby how should I use this contraceptive? When can I use it? When am I using an emergency pill? When am I using an IUD? At community level, at using the radios, all these myths and misconceptions need to be conversations we have. And when we're having some of these radio talk shows and everything, there also needs to be a health expert who can demystify some of these misconceptions, so that it's clear that some of these side effects are not there for everyone. The contraceptive is different with different people. And also there needs to be that responsibility for partners as young people, even if they are engaging in this, whereby the boy child comes in as well and takes responsibility when they're having sex. Yeah, they can also use a condom, and the female can take it upon themselves. There are also female condoms that are there. It's a conversation that we're not having. So we have so many options that are out there, but all these options, because of taboo around sex, we do not take it further to say that we want planned pregnancies, we want families that are wanted, we want children to come in and everyone is like, okay, we're ready, we're great, we want to take care of these people. We want to hide it underneath. And so we cannot go next to the next conversation of the contraceptives that are there. So I think that is really some of the benefits benefits would really be in terms of reducing this teenage pregnancies, and also really it also works in reduction and supports unsafe abortion. Reduction of unsafe abortions really do come about when people are looking at their reproductive health. Yeah.
Thank you, Mageda. You've actually answered quite a number of questions which had come up in our chat in terms of now use of contraceptives and the health of the young people. I wanted to bring in Elsie because matters of law were also mentioned by Rashid before I allow Madam Pesaris, and we can try and start winding up. Elsie?
Thank you, Jamila. I think, wow, so many comments, so many interesting conversations. But I think I'll speak to what is at hand. I think what is key is, do I have the information to then inform me? And what kind of information am I receiving? Collectively from the community, is it that don't do it, or am I being told that this is what this entails, and these are the consequences that may happen? Can we have open conversations? Because the idea of all this is to create advocacy around. Then, like you're talking, Jamila, what laws or policies would then come up that inform or that would, reduce this rate of teenage pregnancies that are on the rise? But yeah, unless Jamila, maybe can you be more specific in terms of Rashid's concerns?
Yeah, Rashid was talking about the laws and you've mentioned it, but also I think I wanted you to talk a bit more about the psychosocial support that young teens would need after it has already happened. Yes, they are not aware, there was no sex education. What next for them? Because they need to continue with their lives.
Yes, agreed. And I've also just seen, someone on the chat box talking about, they're still traumatized, and it's something that happened 10 years ago. And I'm just speaking to, what David mentioned of how the treatment they got at the public facilities and all that. I think, it has happened. We need to be very conscious about this at that point, the children you're speaking to. And it has happened, then we need to come together and support, because then what you're doing is further traumatizing someone. Psychosocial support is key, and it's not just from, it's happened and then the first step is perhaps I've found out at the clinic. There's no need to further shame. And as a collective, if this happens to your cousin, your niece, your nephew, what words do you have? It should be encouraging. And again, that brings up the conversations like, would it then be the time to have that conversation? Then this now brings the topic all the way to to what options are there. So let's give those options and let's let them decide. Otherwise, we all have, varying opinions, based off of religions and etc. But what we're saying is there's education prior, which I think, involves the community and the school. But then afterwards, are we just shaming these then teen moms, or are we, letting them know that, you can have this? And onto the laws, like, I think it's prudent that we have laws that allow for me to be able to make a choice, concerning my future and etc. Can someone tell me, can I have options so that when someone tells me, when I hear an experience from Shiko, and the hardships that perhaps she had to endure as a teenage mom, then I can weigh in, and can the law and the country then allow me to decide whether I want to keep the pregnancy or not? So I think for me, I'd stress on one, availability of options, as Honorable Pasaris was saying, but then information prior and after, and that support is key. And that's also part of psychosocial support, to say, hey, it has happened. I want you to, really comprehensively think about this, and then, have the decision. Let it be, she decides. But yeah, so I think for me, that's it. So it's when you talk of teen pregnancy, of course, the issue of contraceptives is gonna come up, and also, abortion, because I mean, you want to be able to have that option. Yeah, so yeah, thanks, Jamila. I
Thank you,
think for
Elsie.
me
Thank you.
that would be the way to go. Yeah.
I know we wish we'd preach abstinence and our children would practice abstinence, but with this day and age, it's just not possible. And we cannot run away from the conversation about contraceptives and other options that you're talking about. As I bring in Madam Pasaris, Mary, I'd like you to look into the chat, and there is a way for you to reach out to her. Her assistant has put in an email address where you can talk to Madam Pasaris on the CBO that you mentioned. So Mary, kindly go ahead and do that. Madam Pasaris, I'd like you to come in now, and then we can now start winding up the conversation. Thank you.
Okay, so now I'm going to have to now just be a woman, a mother, a daughter. Okay, and I'd like to address Nicole Kirabo. Nicole, I really want to talk to you about the ideal world and the real world. The ideal world, Nicole, is that you live in your household with your parents. You have both mom and dad. They provide you all the best education. You have nobody who will defile you. You have nobody who will rape you. You will meet a nice, decent man who will come to your house and ask for your hand in marriage. He will marry you. You will live a very happily married life until you part ways. And then you will basically have children, and the same cycle will be repeated. Now, you judge me for being probably not a godly person. But, I will not judge you, because only God can judge you and I. For me, I believe that the God that we worship is a loving God. And if he's a loving God, he will not want a child who's defiled, 9-year-old child defiled by her father, being forced to have that child when she cannot look after the child. Or a woman who has 4 children, right, gets pregnant because she has sex with her husband. In spite of all protection, she still gets pregnant, and she cannot afford to look after the 4 children that she has, and she does not want to have the 5th child, being forced to have that 5th child because she had sex. All right, and this is families that we consider a proper, where where we're talking about all structures and everything being right. When we talk about abstinence, abstinence, you cannot tell a child who's defiled to have been avoided that pregnancy when she gets pregnancy. And I look at John Aboud saying no to abortion, no. Well, John, first of all, you don't have a womb. All right, men have used dominance over women and subdued women over the years. All right, and that has been a big point that has really led to women's progress being deterred. So first of all, I think the only person who can talk about a womb is a woman, because she's the one who has the womb, and she has the right to decide whether she wants the child or not to have the child. Our law and our judges actually spoke that abortion is legal in Kenya. First of all, I want you to know that abortion is legal in Kenya when a doctor decides the health of the mother is not okay. The courts have pronounced what does the health of the mother or the well-being of the mother mean. It means social, emotional, economical. All right. So at the end of the day, when a woman cannot afford a child, she should not be forced to have a child. When a woman is unhealthy and cannot afford to have the child, because of her health, the law provides for her. But what if the health is more than just the biological health or the physical health? It could be the emotional health, it could be the financial health. And the courts have spoken to this. So let us not pass judgment. Let us look at our society. We can talk about abstinence. We can talk about HIV, but we know that our children are engaging in sex at an early stage. We know that our children are being defiled and abused. We know that women sometimes get pregnant when they don't want a child. And I want to tell you something. In 1963, when Kenya became independent, Tom Mboya was questioned by the BBC, and he was asked, what are your plans for Kenya? And he said population control in the 60s. Why? Because we only have limited resources as a government. All right. Children are starving every night. Children are stealing and then being shot because they have nothing. So at the end of the day, we need to look at the reality and help protect our society. And that is a joint effort for all of us. So let us not play God, because God has not hired any assistants. At the end of the day, we have to learn to live with each other and accommodate each other and to learn from each other. I see rape is on the increase in Wajir. So all those children who are raped should be made to marry their rapists, or should be enabled to have a safe abortion, counseled, and then taken back to school to continue with their lives while the perpetrator is jailed. So at the end of the day, we have a society that has completely collapsed. The social fabric of this country has gone so low. So what we have to do is protect the girl child, protect women, and ensure that no child is born when they're unwanted. During the post-election violence, we had so many women who were raped. Some of them had the children and they scarred those children for life. They didn't deserve to live or to have those children if they were not going to come into a house where they have love and all the provisions that they require as a child. So please, let's not pass judgment here. We're talking about something where the most holiest of holiest countries, like Rome, has actually legalized abortion. Italy legalized abortion. So why did they legalize it? Because it was absolutely essential to ensure that they protect the girl child, they protect the women, and they protect the child itself, who is born in an unwanted family, in an unwanted environment, out of trauma. Thank you.
Thank you, Honorable Pasari. It's reality. Look at reality. Look at reality. We cannot, again, bury our heads in the sand. We have to look at the situation as is, and we have to take appropriate action. We have to change our thinking and decide this is the way we have to go. As much as we'd like to stay behind our cultural, religious lines, sometimes it's just not possible if we look at how things are going. I'd like to bring in Faith, then Dr. Owini, and then we can start winding up. Faith?
Thank you, Jamila. I think I'll pick it from Mweshimiwa's point of reference, and I'm here making a silent prayer jam for some of the participants here who are, I'm seeing the comments that I don't subscribe to. And I'll give an example. Desmond Tutu, who is apartheid leader and a very honorable African leader that we know, way in 80s and 90s was preaching against LGBTIQ societies until the daughter came out as a lesbian. And he retrograded and started preaching and embracing now the LGBTIQ society. Why? Because this one hit close to home. Some of these topics, until it hits your sister, your mother, your auntie, your niece, or even your girlfriend, is when you start having the eureka moment and say, aha, maybe we need to have these conversations. So I'm here making a silent prayer, hoping that some of these things don't hit close to home. And if it hits close to home, let us not be selfish that we are making some of these comments because we haven't had sisters who have given birth or even have gone through excess bleeding because of unsafe abortion, or who do not have reproductive health issues. Let us not get to that point. For me, when we look at the theme of the whole of this discussion was preventive measures. And one of the preventive measures, of course, that you're talking about is comprehensive sexuality education. And for me, this is a process, and I will emphasize on what Dr. Christine said. Because it is a process, I will look at myself that what is the first stage? I know my body. This is what happens when I have unprotected sex. This is what happens when I don't have unprotected sex. What are the ways for me not to get pregnant? Because we are talking about the whole component of sexuality here. So because it is a process, I go to the next stage. What can I do for me not to have sex? There's abstinence, there's contraceptives. You give information, you're not making a decision for them. There are different contraceptive methods. Fine, I'm pregnant. What can I be able to do? There's antenatal clinic. You give information. There's going back to school. There's even a whole policy around it when you're an adolescent. But then there are also others that are, as I said, not so many people are like Shiko. There are also others who will be like, because they were maybe raped, situations that Mweshimiwa also said, there is also an option, and there is law and standard operating guideline that also protects you. For example, the standard operating guidelines for abortion that was done in 2015 after the case that Mweshimiwa gave. So you are talking from a point of knowledge. And as I said, it narrows down to community. If communities do not have this information, then we go preaching our own values, we go preaching our own attitudes based on our own experiences and based on what we believe in. But when societies are equipped with this information, then they grow preaching the right information so that these young people and adolescents can make informed choices. I repeat what Dr. Christine said, I repeat what Rashid said, informed decision from a point of knowledge. And it starts with the community. And it even starts with over 130 participants that are already here. Let us make conversation from a point of knowledge. Don't just argue because, oh yeah, we are here. Argue from a point of knowledge. Thank you, Jamila.
Thank you. Knowledge. We are told knowledge. Utafute elimu. I was told I don't speak Swahili. Utafute elimu mwelewe. Ndio maana unapoamua kitu unaamua kutoka eneo ambapo unafahamu unazungumza kuhusu swala gani. Muhimu kuwa na elimu, and knowledge is power, they always say. Dr. Win, I'd like you to come in now, and also I'm reminded that we've forgotten about the boy child and people living with disabilities. Are we forgetting about them in this whole conversation, Dr. Win, as you wind up? And I'd like also at some point to request all my panelists to switch on their cameras. We'd like to take one screenshot as we finish up. Dr. Win.
Well, thank you very much. I think I really love the conversation all through. Because of time, I think I want to be brief now. I want to say that there has to be a change process involving people, communities, organizations, religious organizations, and learners in thinking critically and creatively about the future of this country. We must start to have a conversation on how to do things individually and collectively in order to improve the quality of life. You remember, in all of this, we are simply talking about the quality of life, not just for the girl child, also for the boy child, even for that one who is in that bracket of SNE, without damaging the future. In essence, so what we are saying, we need to have a paradigm shift. All these things we've been talking about them, we've discussed. What next? What next? We need to have a paradigm shift. The learning institutions have got a responsibility of taking care of the society, so to say. So we need to go back and rethink sex education and how we can bring it into school. So like in the policy of education for sustainable development, we are talking about learners being on a journey and being assisted to be resilient, to have self-efficacy, to be able to drive their own ways of doing things, becoming innovative, and going away from what is considered the norm and doing what they believe is good for them. And so I want to give a way forward that from this conversation, I want to request if we could have a national task force of experts, including the people that are in this panel, because I have seen we are rich with information and we can really bring about a difference in the field of adolescent development, healthcare, aspects to do with law, education, so that we can create a conversation and also come up with a framework of the key concepts, topics, and messages that surround sexuality and sex, so that we can have the right kind of programs to be cascaded around the country using different medias. For instance, we can have media, we can have the education sector, we can have the health sector, we can have the religious sectors coming in. But after we have a comprehensive policy, so to say, that, or a framework that can be taken out in a unified manner, so that everybody is doing what we think is the correct way to move to curb the challenge that we are talking about. So choices, chances, and changes, very important. You must make the choice to take a chance if you want anything in life to change. Thank you.
Thank you, Dr. Choices, chances, and change. I've learned something new. As we wind up, I just wanted to remind you that this webinar is being hosted by Journalists for Human Rights in Kenya in partnership with AMREF's campaign, Sauti Sasa and crew. I'd also like to remind you that Y-ACT is currently running a contraceptive open day that's ending on Thursday. That's today in 8 health centers in Nairobi, where adolescents have access to contraceptives and the team on the ground is educating them on the same. The health centers are in Dagoretti, Waithaka HC, Riruta HC. In Embakasi East, you have Embakasi HC, Mukuru HC. Embakasi West, you have Kayole 1 Health Center, Kayole 2 Health Center, Umoja 1 Health Center. In Westlands, Kangemi Health Center and Westlands Health Center. In Starehe, we have at Shofco and Huruma Alliance. Thank you, everybody, for the conversation. I'd like to thank our panelists. You're all amazing. I've learned so much. I've been taking notes. and I've learned a lot. And I'll reach out to some of you again for a few clarifications, as I'm going to write a short op-ed about this whole conversation. Thank you so much. Thank you, Elsie, Mageda, thank you, Mary. Thank you so much for your time. Before we leave, I'd like to bring in Winnie Siobua. Winnie, I would like to just say a few words as we wind up. Winnie is our gender lead at Voice for Women and Girls' Rights. As we finish the conversation, kindly let's switch on our cameras, please, or my panelists, so that we can take one short screenshot as we finish. Winnie?
Thank you very much, Jamila. At this point, I really don't have much to say. The conversation has really been very enriching. We have agreed, we've disagreed, we've poked at each other. Information has been properly shared, I want to believe. I've also seen, side chats where people have been exchanging their contacts, and they would like to continue this conversation even outside of the webinar. And so on behalf of AMREF and Journalists for Human Rights, I would like to thank everyone who took their time to come in here and continue and engaging with us. I have a very special thank you for Honorable Esther Passaris. You've always come through for women in this country, not just your constituency in Nairobi. You've done a lot of work with women, and I urge you to continue doing that. I would like to thank you, Dr. Owinyi. You're doing a fantastic job with what you're doing at the education facility where you're working. And we see what you do, streaking down to the people, the children that are recipients of the policies that you formulate, of the decisions that you make with regard to the education sector. For Faith, Elsie, and Mageda, we are seeing the impact of your work through the organizations that you represent. Jamila, we cannot thank you enough. It's surprising that many people do not know that you're a gender champion. They think that you're just a journalist who graces our screens and tells us about the happenings of the day. But on the side, we do know that you're very passionate about gender issues, including in the newsrooms. So continue with that, spirit. And for everyone else, I'd like to say asante, Journalists for Human Rights, and AMREF will continue having this conversation. For us, we will continue to prioritize issues of, access to reproductive health rights for women and girls. We will continue to engage on access to gender rights, as well as, gender-sensitive reporting where journalists are concerned. So asanteni sana, everyone. We look forward to having continued webinars and other engagements outside of this. So have a lovely Thursday and enjoy the rest of your day. Bye, everyone.